very glad you joined us this morning. Before we begin, I'd like to thank our sponsor, Mercy Medical Center, Studio Arts and Glass, and of course, our socially distant technical producer. The show is coming to you live from the administrative offices, and we are joined by our guest, Dr. Aaron Brescia, board-certified head and neck surgeon from Ohio Head and Neck. Good morning, Dr. Brescia, and welcome to the show.
Well, thank you. Glad to be here.
Sinusitis is one of the most commonly diagnosed diseases in the United States, affecting an estimated 16% of the adult population annually. Many who suffer from sinusitis consider it to be a debilitating. In fact, Harvard researchers found that sinusitis sufferers reported the highest levels of pain and the lowest levels of social functioning, as well as significant problems with work, energy, mental health when compared to other chronic conditions. If you or a loved one has suffered from sinusitis, you won't want to miss today's show as we discuss sinus and allergy treatments with Dr. Brescia. We'd like to remind our listeners that our program is available on our podcast, and you can subscribe in the App Store. Just look for the Medicine Center Pharmacy and Health Matters, and you can listen to any of our programs anytime.
So, Dr. Brescia, introduce yourself, please, and tell our listeners a little bit about yourself and about your practice.
Yeah, so I'm Aaron Brescia. I grew up in Akron, and after finishing my training, moved back here to Canton in 2009. So I've been with Ohio Head and Neck Surgeons for 11 years now. My wife and two sons live in Jackson Township, and lifelong Northeast Ohioans.
Okay. People try to blame everything on sinuses for all kinds of problems.
Right.
What are sinuses, and where the heck are they located?
Well, sinuses are air-filled spaces within the facial skeleton. They are lined with tissues, just like the tissues that line the nose. Those tissues make mucus. Those tissues are supposed to also sweep that mucus out of the sinus exits, which are unfortunately very narrow. There are sinuses located above the eyebrows and the forehead. There are sinuses below the eye sockets in the cheeks. There are sinuses between the eye sockets, and then there are sinuses behind the eye sockets. So,
do we need all of them?
Yeah, it's an interesting question. We don't actually, there isn't a real consensus as to why we developed sinuses or what the actual function of the sinuses are. At the very least, being air-filled spaces and not solid bone, they make the face much lighter than it otherwise would be. There's also a thought that they are almost trauma-absorbing or shock-absorbing spaces that are designed to crumble before a trauma gets to deeper structures like your brain or your brain stem. Not unlike a crumple zone at the front of an automobile, designed to collapse and absorb pressure before more vital structures are encountered. So somewhere in there, maybe it's a combination of both, but there isn't really yet a scientific consensus as to why we've developed sinuses, which I'm sure is frustrating for people who suffer from sinus disease, wondering, well, what's the benefit of these things if they're just a source of a problem?
Interesting.
So how are the allergies and sinuses connected?
Right. So one of the problems with the design of the sinus cavities is they're large air-filled spaces, but the exits to them, the natural outflow tracts of them, are very narrow. If you can imagine, if you had a basketball arena full of people and there was one regular-sized door for everybody to get out, and then if there was a fire or an emergency, it would be very difficult to get all of those people out of that one exit, right? It would take a long time. It would be not efficient. But unfortunately, that's the way our sinuses are designed. And so the way the allergy and sinuses sort of intermingle is anything that causes inflammation in the nose, whether it be a cold or allergies can further narrow what is already a very narrow exit door, which can be enough to essentially make it non-functional. And then the secretions that are made all day long in the sinuses as a normal process are trapped. And so whenever you have secretions trapped in the body cavity, you're at risk for infection in that cavity. And so that's a way in which allergies can put you at risk for sinus infection.
So you're not saying that the infection emanates in the sinuses. It emanates in the nose and the nasal?
No, it would emanate in the sinuses because the secretions are manufactured in the sinuses. But if the secretions can't get out as they would normally would be swept, and the natural process would be you make secretions and they get swept out of the sinuses all day long and swept into the nasal cavity down the back of your throat, and you swallow them and you don't notice it. When those secretions can't get out of the sinuses, then they stagnate. And it's almost like having, it's the difference between having a running brook or a stream versus a pond with stagnant water. Pretty soon, those stagnant secretions can get infected. And so then you have essentially a bubbling cauldron of infected secretions trapped in the sinus cavity.
I see.
Okay, so how about this? What are the signs and symptoms of a sinus infection?
Yeah, so they're not terribly unlike the signs and symptoms of a normal cold. Inflammation in the nose, nasal congestion, difficulty breathing through the nose. Oftentimes there's a decrease in the sense of smell and therefore a decrease in the sense of taste. Pain or pressure over the sinus areas depending on which of the sinuses are involved. Usually you're producing a lot of secretions, blowing your nose a lot, and you're getting out thick, opaque secretions. You feel like you're swallowing this sort of foul-tasting secretions, as opposed to, say, when you blow your nose because of allergy, it's typically clear. Or if you blow your nose within the context of a normal viral cold, that's typically clear. Sometimes it can get a little thicker. When you have a bacterial infection in the sinuses, you're typically going to have very thick, tenacious secretions. It's not subtle. And a lot of those symptoms can overlap. One of the things we look at are symptoms persisting beyond a certain amount of time. So your typical cold, nasal congestion, runny nose, difficulty smelling, all those things, pain or pressure in the face, typically will peak around days 4 or 5, and then they should start to wane, and you should start to feel better after, day 6 or 7. If patients' symptoms get worse after that time, after day 5 or 6, we start to think, well, they're probably developing a bacterial sinus infection. If symptoms persist beyond 10 days and aren't improving, those are things that we look at to say, okay, this is now a sinus infection as opposed to, say, a viral cold that we get all the time. So it has to do with the intensity and the duration of symptoms where we start to suspect that you've actually developed now a sinus infection. So that's why your doctor may be hesitant. If you go, if you feel crummy for 2 days, blowing your nose, nasal congestion, and you go to your doctor and you want antibiotics, your doctor may be hesitant to prescribe antibiotics because it's inappropriate, really, until those other benchmarks are sort of met, because we don't want to over-treat viral illnesses with antibiotics for a lot of reasons.
Okay.
So, how do the sinuses get infected?
Well, there are 2 main types of cells in the lining of a sinus cavity. One type manufactures mucus, and one type is specialized to help sweep the mucus out toward the exits of the sinuses and into the nasal cavity. Sinuses get infected typically when those exits are blocked, and either from things like nasal polyps, actual tissue in there that's blocking up the outflow tracts, or just even inflammation that blocks the outflow tracts and the secretions get trapped, that puts you at risk for infection.
It seems like a complex system when it's. I don't think it's really needed, is it? Is that what you're saying?
Well, that's not my department.
I just when you think about it, you think about all the aggravation that people get from.
That's right. That's right.
Like, what's this about?
Right. I mean, even things like irritants. If you're a woodworker and you don't wear a mask, if you're inhaling particulate matter that is an irritant to the lining of the nose and sinuses, that can incite inflammation, and that inflammation then blocks up the exit tracts of the sinuses. Secretions get trapped, and you get infection. So anything that causes irritation or inflammation in the nose puts you at risk for infection.
Okay, I guess we're going to take a break here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Hi, Paul White from the Medicine Center Pharmacy. From 1976 to the new year, 2020, we've been part of the Canton community. This year, we celebrate 44 years of service. Thank you for your business and continued support of the Medicine Center Pharmacies. A lot has changed in the pharmacy world over the past 44 years, but one thing hasn't: our commitment to your health. Stop by your local Medicine Center Pharmacy in Canton, Louisville, Minerva, or New Philadelphia, where wellness begins.
Mercy Medical Center wants you to know we are here for you literally and virtually. For our patient safety, Mercy is providing virtual doctor appointments from the comfort of your home. This service is available for stat care, urgent care, 7 days a week, and Mercy Primary Care Monday through Friday. See our website at cantonmercy.org/telehealth for office and appointment hours. Mercy telehealth visits are simple, convenient, and can be used by anyone who has access to a smartphone, tablet, or computer. Our Mercy representatives are ready and happy to assist you. So, whether you are in need of urgent care for minor illnesses and injuries or would like a one-on-one with a Mercy primary care physician, Mercy is here for you. Mercy Medical Center telehealth appointments. Learn more at cantonmercy.org/telehealth. That's cantonmercy.org/telehealth. Online appointments are considered medical services and will be billed to your insurance copays and deductibles apply.
Is CBD oil right for you? That may seem like a simple question, but the answers don't come from a convenience food store or a mall kiosk. Your Medicine Center pharmacist is the most accessible healthcare professional. Our pharmacists have been trained to provide expert CBD oil information to tailor therapies like CBD capsules, tinctures, lotions, and ointments to your particular need. We have the highest quality, organic, Colorado-grown, non-GMO, full-spectrum CBD oil products. Visit the Medicine Center pharmacies in Canton, Louisville, Minerva, or New Philadelphia. Hi, Paul White from the Medicine Center Pharmacy. In these difficult times, please stay calm and make sure your medical and healthcare supplies are well stocked. Have Kleenex, pain relievers, fever reducers such as Tylenol, and cough syrup like Robitussin, Dayquil, cough drops, and maybe a humidifier. And make sure you take a good multivitamin like Linus Pauling Super Multivitamins. Also, you might get a good probiotic, and make sure that you get plenty of rest and plenty of nutritious food. The Medicine Center Pharmacy in Canton, Louisville, Minerva, and New Philadelphia.
Go.
Welcome back to Health Matters with the Medicine Center Pharmacy. Brad and I are talking this morning with Dr. Aaron Brescia from Ohio Head and Neck Surgeons. So, Doctor, how many sinus infections per year are abnormal, and when should you really get to the physician?
Well, there's no normal amount of sinus infections that we should expect. So one is abnormal. But we don't necessarily think that people need surgery or serious intervention in the sinuses unless there seems to be a pattern. Something is putting them at risk for repeated sinus infections. When you should seek a doctor's advice, again, usually if cold symptoms worsen after days 5 or 6 as opposed to start to get better, or if symptoms persist beyond 10 days, that's a good time to go see your doctor, because then I think he or she would be more comfortable probably writing you an antibiotic, make an empiric choice on an antibiotic for sinus infection. But as an ears, nose, throat doctor, if we're seeing patients who've had multiple sinus infections over the past year, we want to look for what are the risk factors. Why is this particular patient more at risk for developing sinus infections than the next person? Everybody gets colds, and anybody that gets a cold can develop a sinus infection. Doesn't necessarily mean you need sinus surgery or a major sinus intervention. But if there's a persistent pattern, repeat sinus infections, it may be because you have undiagnosed or undertreated nasal allergies, or it may be because there's some anatomic concern that makes your sinus drainage pathways less efficient than the next person's. And that's our job as ears, nose, throat doctors, to sort of figure out why a particular person develops more actual sinus infections than the next person, and then either address that concern and to prevent sinus infection, or if it's an anatomic concern, then intervene surgically to improve that anatomic problem.
So how do we evaluate this? I mean, you mentioned CAT scan, but we can't give a CAT scan to everybody. So, how do we evaluate what's going on up there?
Yeah, exactly. So the first thing is obviously a good history and physical. You're right. We don't obtain CAT scans on everybody. If somebody were to come and see me and say, I had a sinus infection, and my doctor or the stack here gave me an antibiotic, if it's not the best choice for an antibiotic, or if there are other medical therapies that can help in conjunction with antibiotics, then I would prescribe that and see the patient back. I'm okay treating 1 or maybe even 2 sinus infections in an individual a year if we can, if given the right antibiotics, we can get them through it. But if somebody comes to me and says, well, I've been on antibiotics multiple times every 6 weeks, seems like I feel okay for 3 weeks, and then I'm right back where I was, those are indications to start looking at perhaps getting a CAT scan, which is the image of choice, really, and to try to evaluate the anatomy of the sinus cavities and the outflow tracts of the sinus cavities.
Can we see all the sinuses in a CAT scan, like the ones behind the eyes and all that?
Yeah, that's right. And we can do that in our practice at Ohio Head and Neck Surgeons. We can do that right here in the office. But yes, there is a very specific CAT scan for the sinuses to image the sinuses.
Amazing. Go ahead, Brad.
All right, so I'm guessing surgery isn't always necessary, but
right.
If it is, how do you do it, and what do you do?
Right. So sinus surgery, whether it's sort of minimally invasive sinus surgery like the sinus balloon that people may have heard about, or more formal sinus surgery that occurs in the operating room, the goal of any sinus surgery is to identify the natural outflow tracts of the sinuses and improve them or expand those outflow tracts, and irrigate the sinuses, evacuate secretions or polyps or cysts, anything that is impairing the outflow of the sinuses and give the patient a clean slate moving forward, hopefully with better outflow tracts and better sinus anatomy that puts them at less risk for developing sinus infection. So in short, the goal of a sinus intervention or surgery is to improve the natural outflow tracts of the sinuses through whatever methods that are appropriate.
Okay, Doctor, it's the bottom of the hour, time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com.
WHBC AM Canton, reliable as ever on News Talk 1480 WHBC.
Mercy Medical Center wants you to know we are here for you literally and virtually. For our patient safety, Mercy is providing virtual doctor appointments from the comfort of your home. This service is available for stat care, urgent care, 7 days a week, and Mercy Primary Care Monday through Friday. See our website at cantonmercy.org/telehealth for office and appointment hours. Mercy telehealth visits are simple, convenient, and can be used by anyone who has access to a smartphone, tablet, or computer. Our Mercy representatives are ready and happy to assist you. So, whether you are in need of urgent care for minor illnesses and injuries or would like a one-on-one with a Mercy primary care physician, Mercy is here for you. Mercy Medical Center telehealth appointments. Learn more at cantonmercy.org/telehealth. That's cantonmercy.org/telehealth. Online appointments are considered medical services and will be billed to your insurance copays and deductibles apply.
Yes, we are open. We are open. The Medicine Center pharmacies and the Half Off and Out By store in Louisville are open. Some great services are still in play. Our drive-through windows, curb service, and our enhanced delivery service. Our stores are fully inventoried and fully staffed for your convenience. 13 pharmacists to help you with your medications and over-the-counter products. So don't hesitate to visit us or use one of our services. Medicine Center pharmacies in Canton, Louisville, New Philadelphia, and Minerva.
Special event at Studio Arts and Glass, September 11th and 12th. Fall Festival of Art combined with our annual tag sale outside in a tent featuring local artists, pottery, glass, and jewelry. Take a class and make a dried hydrangea wreath or a glass sunflower. Enjoy a corn dog and a candied apple. Fall Festival and tent sale at Studio Arts and Glass, September 11th and 12th, 9 to 8 p.m. on 77 and Apple Grove in North Canton.
Hi, Paul White from the Medicine Center Pharmacy. In these difficult times, please stay calm and make sure your medical and healthcare supplies are well stocked. Have Kleenex, pain relievers, fever reducers such as Tylenol, and cough syrup like Robitussin, Dayquil, cough drops, and maybe a humidifier. And make sure you take a good multivitamin like Linus Pauling Super Multivitamins. Also, you might get a good probiotic, and make sure that you get plenty of rest and plenty of nutritious food. The Medicine Center Pharmacy in Canton, Louisville, Minerva, and New Philadelphia.
Your severe weather station, News Talk 1480 WHBC.
You're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. Today, Brad and I are discussing allergies and sinus concerns. We've got a lot more to cover this morning, so let's get back to the show.
All right, Doctor, before the break, we were talking about sinus surgery and how often it's necessary. How about this? How has sinus surgery evolved over the last couple decades?
The biggest sort of advance in sinus surgery is, well, the first major advance was the development of instruments, cameras that are designed to go into the nose and get into the sinuses through their natural openings, as opposed to having to make external incisions on the face to get into the sinuses. So in the 80s, mostly, this idea of endoscopic sinus surgery started to evolve and become perfected. Because before that, you had to make an incision on the face to get into a sinus cavity. So now that almost never is necessary, and the vast, vast majority of sinus surgery takes place with cameras in the nose without any outside incisions or scars. And so that was the major transition a few decades ago. The other thought was, the other sort of major advancement was the idea that, for instance, if you think of the cheek sinuses underneath the eye sockets, it used to be that the philosophy was, well, if something needs to drain better, let's put a hole in the bottom of it, like it's a bathtub, and then secretions will just naturally fall towards gravity and fall into the nasal cavity that way. So making a window or a drain in the bottom of the sinus on the inside of the nose was a standard procedure for a long time. But as our understanding of the physiology of the sinuses evolved, what we learned was the natural outflow tract of the cheek sinus is not at the bottom of the sinus, as you might think. It's actually reasonably high up on the inside wall of the sinus cavity. And so what we found is recurrence rates of sinus disease, sinus infection.
The host would like you to unmute your microphone. You can press *6 to unmute.
Goes way down if you just concentrate on locating the natural opening of the sinus cavity and expanding that, as opposed to making a drain hole at the bottom of a sinus cavity. So when we refer to sinus surgery now as functional endoscopic sinus surgery. And the functional part means we just utilize the natural outflow tracts, the natural anatomy of the sinuses, and improve them, as opposed to making new drain holes in sinuses. So those two advances are really the major developments in sinus surgery. More recently, this balloon technology, where we can actually, as opposed to removing tissue and bone from the outflow tracts of the sinuses to expand them, we can do a less invasive procedure utilizing balloons, not terribly unlike when you want to improve the caliber of somebody's heart vessels, and we can endoscopically or with cameras inside the nose place balloons in the outflow tracts of the sinuses and then expand those outflow tracts. We can also irrigate the sinuses through those balloon devices. And that's actually something I can perform in the office just with topical numbing medicines inside the nose, as opposed to going to the operating room and having general anesthesia. And so that's sort of this less invasive office-based intervention is going to be the sort of next major advancement in intervening in the sinuses and improving the health and the drainage pathways of the sinuses.
Okay. That's interesting. So I've heard of sinus balloons. Is that an alternative to surgery, or can it be, and can it be done in the office setting?
Yeah. So if you have to, of course, have the right candidate, and you have to have the right amount of sinus disease. But yeah, given those conditions, we can offer balloon sinus surgery in the office just with numbing medicines in the nose. And so I've done a few dozen so far in our practice. The patients have done very well. There's not a lot of pain, and they just come into the office and go home. It takes about half an hour, 45 minutes. And patients obviously like it. It's less expensive. It's less invasive. You don't have to go downtown and park and all of those things.
So is this a permanent fix or this ballooning technique?
Well, it can be. I mean, if you make if you're choosing the right patients and the right sinus disease, then yeah, there's no reason why you can't, fix the problem just with the sinus balloon.
How big is the balloon?
The balloon is, it's not big. It's about 16 millimeters long. So, just a couple inches, about an inch and a half. by only about a centimeter and a half wide. So it's very small, and it goes in with a very thin applicator and then gets into the sinus cavity and then expands it. So, it's pretty interesting technology.
When would we use this? I mean, what?
Well, you would use it if you don't have to do. So sometimes when you're intervening or you're doing a sinus surgery, it's because there's polyps, there's fungus, there are things that have to be physically removed from the sinus cavity. That's typically going to happen in the operating room with a more formal sinus surgery.
Sure.
But if it's just trapped secretions, and especially if it's in a limited number of sinuses, and you have the right patient, they have to be able to sort of tolerate having things placed in the nose while they're awake and all those things. That's the kind of patient that's a good candidate for an in-office balloon. If we just need to get in, open the outflow tract, irrigate the sinus, and evacuate the secretions that we think are trapped in there, then that's perfect for an office-based procedure.
Well, this may be down the road on the questions here, but what about the polyps? Okay, you wouldn't use a balloon with polyps, right?
No, right. If you need to go in there and physically, if a patient has polyps, which are just inflammatory masses that some people are more apt to develop than others, then those are typically going to need to be physically removed in the operating room. They tend to bleed when you manipulate them or remove them. Doesn't really lend itself to having somebody awake in the office. So those patients are typically going to go to the operating room.
So the instrument we use would be sort of like a colonoscopy, a little loop, and you cut the difference.
Yeah. Well, I guess the difference is, in a colonoscopy, polyps are on the surface.
Okay.
You don't have to get into a narrow recess or get into a small bony space in order to get the polyp out. So that's, the difference there.
Okay.
All right. So let's talk COVID-19 and sinus and allergies. Some have some similar or common symptoms, right, including a decrease of smell. So how are you helping patients evaluate the difference?
Well, fortunately, I haven't had too many COVID patients come in with the complaint. I've had maybe 3. But you're exactly right. The loss of smell associated with COVID or any virus, even the common cold, unfortunately, is typically a nerve problem. The smell centers, the primary smell centers in the nasal cavity are high up here in what we call the nasal vault. And so in order to smell, you have to be able to get air high up into the nasal vault. So things like polyps, inflammation, either from a cold or allergy, anything that obstructs airflow to the higher levels in the nasal cavities can give you a trouble with a loss of smell. And so one of the first things we need to evaluate if somebody's coming in for that is there a physical obstruction to the airflow in the nose? That's very easily evaluated with placing a small fiber optic camera in the nose in the office here just to look for physical obstruction. And that sort of thing is going to give you what's called a conductive smell loss. Nerve smell loss, unfortunately, is, the most common reason or the most common cause of something like that would be a virus. And it's not typically fixable. Sometimes it comes back and sometimes it doesn't. But there won't be anything to see on physical exam. There won't be anything to see on CAT scan. It's mostly about the patient's history, and the lack of physical obstruction in the nasal cavity is going to have you settle on a diagnosis of a nerve smell loss. It probably has to do with nerve inflammation, though we can't prove that. We may place the patient on steroids therapy, again, because they're the most powerful anti-inflammatory medicines that we have. But we can't tell you. It's hard for us to predict how much, if any, smell is going to come back and when it's going to come back. It could be a few weeks. It could be a few months. It could be never. So any viral illness can come in, the flu, a cold, and COVID-19, obviously, and cause a nerve smell loss, which is very unpredictable in its prognosis, unfortunately.
Okay. Final breaks here. You're listening to Health Matters with the Medicine Center Pharmacy.
Yes, we are open. We are open. The Medicine Center Pharmacies and the Half Off and Out By store in Louisville are open. Some great services are still in play. Our drive-through windows, curb service, and our enhanced delivery service. Our stores are fully inventoried and fully staffed for your convenience. 13 pharmacists to help you with your medications and over-the-counter products. So don't hesitate to visit us or use one of our services. Medicine Center Pharmacies in Canton, Louisville, New Philadelphia, and Minerva. Is CBD oil right for you? That may seem like a simple question, but the answers don't come from a convenience food store or a mall kiosk. Your Medicine Center pharmacist is the most accessible healthcare professional. Our pharmacists have been trained to provide expert CBD oil information to tailor therapies like CBD capsules, tinctures, lotions, and ointments to your particular need. We have the highest quality, organic, Colorado-grown, non-GMO, full-spectrum CBD oil products. Visit the Medicine Center pharmacies in Canton, Louisville, Minerva, or New Philadelphia. Hi, Paul White from the Medicine Center Pharmacy. In these difficult days, please stay calm and make sure your medical and healthcare supplies are well stocked. Make sure you have Kleenex, acetaminophen or Tylenol, ibuprofen or Advil, Mucinex, Robitussin or Dayquil, cough drops, maybe even a humidifier or a vaporizer. You can also just turn the shower on hot and sit in the bathroom breathing in the steam. How about vitamin D and a probiotic? And a good multivitamin like Linus Pauling Super Multivitamins that you'll find only in the Medicine Center pharmacies. So take care of yourselves and don't stress about the coronavirus. Make sure you get plenty of rest and plenty of healthy food. The Medicine Center Pharmacy, Canton, Louisville, Minerva, and New Philadelphia. Are you tired of spending time sorting your medication? Hi, pharmacist Paul White for the Medicine Center Pharmacy. Whether you are a caregiver or personally take medications, our pill packets will change how you take your medication forever. Instead of multiple pill bottles, you'll want to receive one easy dispensing box that contains all of your medications in individual packets. Organized by date, time, with instructions clearly labeled, it's simple, convenient, and safe. Call or stop by your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins.
You're listening to Health Matters with the Medicine Center Pharmacy on News Talk 1480 WHBC.
Welcome back to the Health Matters with Medicine Center Pharmacy. I'm your pharmacist, Paul White. Thanks for joining us. And we are talking with Dr. Aaron Brescia today from Ohio Head and Neck. I have to give a shout out today to our very special sponsor, Studio Arts and Glass, and Wendy Joliet. She is going to be on New Day Fox 8 Cleveland program from 9 to 10 a.m. next Thursday, talking about Studio Arts and Glass. And if you've never been to her shop, it's a trip. You need to go there. So, Doctor, we are on back. We kind of didn't finish this nasal polyps thing, did we? Or did we? I guess we did, huh?
I don't know.
Okay. How do we treat them? Do they come back?
Yeah, so nasal polyps are a pesky problem. They're typically associated with chronic inflammation. There are some patient factors that put some people at risk for developing them, whereas other people with all the exact same exposures don't develop them. That has to do with some of the genetics of the immune system for certain individuals. Anything that causes chronic inflammation can put you at risk for nasal polyps. Again, things like woodworking, being around solvents, but otherwise people just develop them even without those risk factors. They are a problem because they are just physical obstructions to nasal breathing. They can be physical obstructions to the outflow of the sinus cavities, again, leading to trapped secretions and putting people at risk for sinus infection. How we treat them sort of depends on how extensive they are and how miserable the patient is. If we see nasal polyps in somebody, we'll obtain a CAT scan of the sinuses to see if there is also then sinus blockage and trapped secretions in a sinus cavity. Doesn't necessarily have to be that way. People can just have nasal polyps in their nasal cavities, but oftentimes they're associated with sinus blockage. So there's probably going to be a CAT scan. Systemic or oral steroids like a Medrol dose pack or a prednisone taper can shrink polyps. If the patient is symptomatically doing okay with their level of polyps, you don't necessarily have to intervene surgically. Though we can't keep people on oral steroids long term, they can be used in the short term to help. And then administration of nasal steroid sprays like fluticasone, or the brand name is Flonase, that a lot of people have heard about. Things like Nasonex, Nasocort, Rhinocort. These are nasal steroid sprays. They can be used as on a daily baseline basis to help keep polyps controllable. But if polyps are too extensive or the patient is uncomfortable, can't breathe, can't smell, getting sinus infections, then those polyps have to be physically removed, typically with a sinus surgery in the operating room. And then post-operatively, the onus on ears, nose, throat doctors is to try to develop a strategy to keep the polyps that we know are going to come back at some point, unfortunately, try to keep that return to a minimum, keep it to some kind of manageable level so the patient isn't very symptomatic from that. So
I think it's interesting on the package, the nasal steroid package, that it says, looking at it a couple nights ago, one puff or one spray daily as opposed to multiple. Apparently the so-called power of the product, it is extremely effective, and you don't have to use it 2 or 3 times a day.
What I will usually tell a patient is patients can use nasal steroid sprays, either 2 sprays each side once a day or 1 spray each side twice a day. And some patients like having they feel like for the first 3 or 4 hours after they take their spray, they really feel good and open. Then that might be somebody who wants to do it twice a day. So either one is indicated, 2 sprays each side once a day or 1 spray each side twice a day. But the key to any nasal steroid regimen is nasal steroids are designed to be used every day. They're not the kind of medicine that you can use because you're having a bad day, the pollen count is up, and so you're going to use your nasal steroid, but you might not use it for another 3 or 4 days. If you have a bad season for allergy, let's say you have a tree allergy and the spring is tough for you, you need to start probably 2 or 3 weeks before your allergy season and use it every day through that allergy season to really get the best benefit from your nasal steroid therapy. Nasal steroid patients typically won't see a good effect of the nasal steroid sprays for at least 2 or 3 weeks. So I always try to counsel patients, don't give up. If you're going to start a nasal steroid spray, stick with it. And I usually won't see patients back for at least 4 to 6 weeks for a return visit, so that then we can determine how effective or not it has been for the patient. A lot of people will try them for a week, and then they go, well, it didn't really work for me, and then they give up on them. But that's not really giving them a good chance.
I think they're amazing. I mean, I use one of their. I think they're all the same pretty much, and I use one that started some time ago, and I think they're amazing. They really do a number.
Yeah, and you're right. The molecules themselves, the medicines themselves, are all pretty similar. What's being developed now is more efficient ways to deliver the nasal steroid spray in a little bit more specific areas inside the nasal cavity where the sinuses open up and where polyps tend to form. So that's kind of the newest thing in the world of nasal steroids. Nasal steroids, of course, have been around for a long, long time, but we're trying to look at more efficient ways of delivering them exactly where we want them to get an even better benefit from them.
Well, so many people will not use a nasal spray. It's very interesting that, I can't do that. I couldn't put it in my nose.
Right.
Convincing them to use one of these products. Oh, and then they come back in and hey, this worked great, man. Thanks a lot.
Yeah. Well, especially something like your generic Flonase.
Yeah.
There's a little bit of alcohol in that carrier solution. Some people are averse to it, and so there are other medicines on the market that carry the same steroid medicine, but maybe in a more gentler solution.
I don't know where we're at on time. We got time to discuss allergy shots?
Well, I want to make sure we get Dr. Brescia's contact info and things of that nature. Let's do that. And then can you also add, do patients need a referral to come see you, or can they call your office directly? So if you could cover those things.
Yeah, sure. So we're Ohio Head and Neck Surgeons. We're an ears, nose, throat practice. We've been in Canton for 50 years. There are 4 of us working here now. Myself, I'm Dr. Brescia, Dr. Charles Bogdan, Dr. Daryl Smith, and Dr. Kent Ramsey. And we're all local guys. We all grew up around here. Whether or not you need a referral to come see us mostly depends on your insurance provider. A lot of people are free to call and make their own appointments, but some people's insurance wants them to go through their primary care doctor to obtain a referral. So I don't have a blanket answer on that. But yeah, so we have a website, ohioheadandneck.com. And of course our phone number, 330-492-2844. And we're all actively taking new patients. We can typically, one of us can accommodate a new patient usually within 2 or 3 weeks. So it shouldn't be too difficult to get an appointment with us. Typically, at least one of us is here every day of the week. So if there's a particular day of the week where a patient might have more of a chance to do things, get to doctor's offices and things like that, there should be a doctor here on that day for them.
Okay, doctor. Thanks for coming on the show today.
Thank you for having me. I enjoyed it.
We always learn something, particularly about our nose, which is a real pain in the neck sometimes, So again, thanks to Dr. Aaron Brescia, board-certified head and neck surgeon from Ohio Head and Neck. I'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to Mercy Medical Center, Studio Arts and Glass, and of course, our technical producer. As always, we thank our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you again right here Friday on News Talk 1480 WHBC.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists, Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's medshop.rx.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy.